this is Dr. Paul Goldberg of the Goldberg Clinic in Kennesaw, Georgia. I'm here with Tom and Julie Shadid of Normal, Illinois. You guys are Yankees like me, originally. Yeah. And Tom has been under our care for just a little over 2 years. Came to us in, was it 2016? Yes?
Yes.
Yeah, in 2016 with a case of medically diagnosed rheumatoid arthritis. And Tom had been under medical care for a little while. Tom, as I recall, you were taking steroids. You were on prednisone, as many people are when they first come to our clinic. And you were also on methotrexate and Plaquenil.
Yes.
Were you on sulfasalazine also?
I started sulfasalazine temporarily, and I just could not tolerate with my stomach. Just could not tolerate it. I was on it for about 2 weeks.
Right. Julie, tell me a little bit what was going on with Tom. As you were right there with him as his wife, and what was his situation?
Just this kind of overnight almost, he started experiencing a lot of pain, aches and pains, and didn't know where they were coming from, and just very frustrating for him.
Right. And Tom's an accountant, works with the University of
Illinois State University.
Illinois State University.
Yes.
He's an accomplished accountant and also a very active person. Both he and Julie are very active people, and then this was a very frustrating thing for Tom, as is with any active person, to suddenly be afflicted with a rheumatoid disease like this. And so he had been under the care of a rheumatologist and wasn't getting very far with it. And tell us what was happening, Tom, right before you came to see us.
I was waiting to get in to see the rheumatologist. I had to wait for an appointment, and by the time I saw him, he went ahead and started me because I was in really bad shape. Swollen ankles, swollen elbows, just really, really hurting just to get around.
Yeah, because you didn't just have a surgical issue, you had a systemic problem.
Yes.
With a rheumatoid issue, and they diagnosed you as rheumatoid arthritis. And Tom's fortunately a very cooperative guy. He followed we did a workup on him, and he was very cooperative. But we had a significant challenge for Tom, as with other people, that you were on prednisone, steroids, and
Yes.
you can see on our website, which is goldbergclinic.com, we have an article there about problems with prednisone. And in the 40 years I've been working with patients with a number of different types of autoimmune problems and other issues too, getting off steroids is really hard to do. And yet it's very important, because taking steroids doesn't address the problem, it just suppresses the symptoms, and it has a number of very, very serious consequences and side effects with it. So that was a tough time for you getting off of that.
That was very difficult, and it was really difficult because I've been having a lot of trouble with sleeping, just a lot of really, really bad side effects that I just felt horrible on it, and had to go off really, really slowly. And once I did go off, things really, really kind of took off as far as symptoms again. Just from withdrawal.
Sure, because as I say, steroids are, enjoy it now because you're going to pay for it later. The symptoms can be very, very bad. And Tom, fortunately, he toughed it out. He worked with us, seen us periodically. And today, which is, we're at day after Halloween, November 1, 2018, what's your situation today?
Well, I feel like I'm in a much, much better place than where I started. I still have some residual symptoms I'm dealing with, but I got off of the methotrexate a little over 2 months ago, and I just recently came off of the Plaquenil that I was on.
So you're now drug-free.
Drug-free.
And overall, percentage-wise, what's your improvement at this point? And this is off the drugs, off the steroids, off the methotrexate, off the Plaquenil, off the sulfasalazine. What's the percentage improvement you have now?
I would say I'm about 75%, maybe 80%. It's difficult to really put a number on it, but I would say somewhere.
It's difficult for an accountant to put a number on it.
Yes, we're so precise. It's very difficult to pin it down. So.
Well, I hope one day it's 95 or 100, but I'll go good with 80%, considering you were going downhill before, and considering also this is a person, this is you now off of all drugs and 80% better.
And also with that, I have noticed over the last couple of months or so, I just have had a more stable energy level. I was having pretty severe fatigue, on a weekly basis. And now it seems like I'm just a little bit more steady energy-wise and just feeling better, just general well-being feeling.
Because unlike the medical world where they treat disease, we don't treat disease at the Goldberg Clinic. What we do is we build health. So we didn't treat Tom's rheumatoid arthritis. It's 80% gone, all the symptoms, but we didn't treat it. We built his health with his and Julie's cooperation, of course. And so today we have somebody who also is in control of his health. And that's what we want for all of our patients, to be able to control their destiny and their future without ongoing doctor's visits to anywhere, including to us. Julie, your observations?
It's just nice to see the old Tom coming back. He was in a bad place for a really long time, and it's just nice to have the old Tom coming back.
That's a beautiful thing to say. All right.
And I will say, one of the things that I've learned through this process with Dr. Tenner and with Dr. Goldberg's help is truly what healthcare really means. And to me, what I thought healthcare was long before this happened is quite different than what I know healthcare really truly is. You've taught me how to take care of myself and what good health really looks like and feels like. And I also want to say how important it's been for me, for my wife Julie, who's been by my side through this and stuck with me and supported me. And without that, I could not have done and accomplished where I'm at right now. I wouldn't be where I'm at today.
Absolutely.
So thank
Kudos
you,
to you, Julie.
But thank you, Dr. Goldberg and Dr. Tenner, for guiding me and teaching me how to care for myself and how to get well.
Okay. Thank you very much, both of you.
Thank you.